I'm Scott Brees. I am the Chief Information Security Officer for Community Health Systems. We are a general acute care provider for 158 hospitals across 22 states with approximately 27,000 beds. When we started working on identity and access management, some of the business challenges we faced was having multiple applications and a variety of applications across 100 and something hospitals, as you can imagine. For example, in one of our hospitals in Birmingham, when we first converted them over to the CHS standard, they had approximately 13 different clinical applications in the McKesson suite. So they were required to remember 13 different username and passwords. You can imagine the support model in order to create the username and passwords for a clinician and physician staff of approximately 2,700 users across 13 different applications was quite cumbersome. The other challenge we had is how many times could we reduce the login for a physician throughout the day, because if they are seeing approximately 20 to 30 patients daily, they would have to remember and enter in a username and password that many times. So in the process, you're trying to minimize the impact of patient care because they're still continuing to deliver the patient care as part of their daily responsibilities. But our primary goal was to improve physician satisfaction. That's what we came up with in our end solution. Was we laid a single sign-on technology on top of the identity management solution, and they enter a username and password. They go up, they tap the workstation, it populates their username, and then they enter their password. The rest of the day, they can walk throughout our hospitals, and even remotely, they can use that single sign-on capability to insert their username and password, and it passes them right through. We manage approximately 280,000 users. In our environment, we have integration with approximately 40 to 50 different applications. The results of our top priority around the physician satisfaction piece was they loved it. We couldn't get it rolled out fast enough.
So in working with CHS for the past 8 years, we've discovered quite a number of benefits. When they add a new application into their business, whether it's a billing application or a marketing application that's client-facing, they make identity part of the project implementation program. So then it's being driven by the application owner group and not by the security group, although the security group oversees it. That's a giant cultural shift from any client we have. It also is a great way to get budget for the security offerings because the application owner makes it part of their implementation budget because it's part of what CHS does on every application.
We chose the Micro Focus Identity Manager solution for a few reasons. At the time in the marketplace, it was the best workflow engine. It had the most robust capabilities of an identity management system. It was very well-rounded. It offered multiple capabilities and just functionality within the solution itself, but it also provided the best integration. As we move forward with the Micro Focus Identity Management application and all of its surrounding components, CHS, GCA, Micro Focus, we're really excited to see where we're going in the future, especially as technology evolves. So we're really excited to see where the future takes us.